AstraZeneca is seeing strong business growth in the Middle East and Africa. The pharmaceutical giant is committed to improving the lives of millions of patients across the region, collaboratively with partners, with a focus on innovation, sustainability, and therapy area leadership. Dr. Pelin Incesu is the Area Vice President for the Middle East and Africa at AstraZeneca. And she joins us now. Thanks so much for being with us today, Dr. Incesu.
Thank you so much. It's my pleasure to be today with yourself.
You are one of the few women leaders in the pharmaceutical industry in this region. Tell us about your journey so far and how you got to where you are today.
Thank you. Actually, my career started in Istanbul, Turkey, my home country, as a medical doctor and a psychiatrist. But my passion for science led me to pursue my career in pharmaceutical industry. And I'm here at AstraZeneca for the last over 20 years, working great 2,500 people in Middle East and Africa geography. And also, actually, I'm proud to be working in AstraZeneca, such a company. We have a stated goal, putting an objective for ourselves for the gender parity by 2025. So we are so successful up until now. We have 50% female leaders in our global workforce to mentor, to encourage, to empower female leaders to pursue their careers in senior roles.
And 50% is a really remarkable achievement, so congratulations. I would like to ask you a little bit about the pandemic. This is when AstraZeneca became a household name. How did the pandemic change your company?
Yeah, I think maybe the biggest learning out of the pandemic was without partnerships, without strong collaboration, it's almost impossible to save lives. And I think AstraZeneca is a great example. AstraZeneca did a great contribution, a successful way to the pandemic, not just accelerating the development of the vaccine, but also distributing that vaccine across the world. More than 3 billion doses, mainly the low-middle income countries. And what is behind this success is actually the strong collaboration with all the partners in the healthcare ecosystem, regulators, policymakers, healthcare leaders, and all the relevant stakeholders. So it was behind the success. But it is not limited because unfortunately, pandemic is not over. The battle has not finished yet, but as company, our focus is on now to protect the high-risk patients. These are the vulnerable patients, immunocompromised patients, cancer patients, chronic patients that we really need to be sensitive how to protect them during this journey. And also we have so many efforts to drive the changes because we don't know what we don't know for the future. Healthcare system resilience is quite important. This was another learning. So we are working in therapeutic areas such as oncology, rare disease, metabolism, respiratory, and cardiovascular therapeutic areas to really improve the policies, how to make it stronger for the future challenges that could come up.
And speaking about these future and current challenges, last month we saw world leaders gather at the World Economic Forum to address this very subject. What is AstraZeneca doing to drive positive impact in this region?
Yes, I think all of us know there's no doubt that public-private partnership is essential to overcome the barriers and the major challenges of healthcare. And as AstraZeneca, we strive to be the partner of choice for the governments to solve the problems, finding innovative alternative solutions for those challenges. So we have great partnerships, and one of them may be a couple of examples I can just share with you. Department of Health and innovative healthcare company G42 to support the ambition of Abu Dhabi to become the regional life science hub with bringing innovative solutions for the service of the patients. Another great example that we recently announced a partnership with the Kingdom of Saudi Arabia, this time on research and development, bringing the life science again, and also to localize the drug discovery. To using the innovative techniques, future techniques, bringing it to the local country. And the third one may be related, it would be a good example, the Cancer Care Africa, our efforts towards to support the lives of the cancer patients, but all through the patient journey, from diagnosis to the treatment, because we all, as AstraZeneca, want all the people having the equitable access to the healthcare services wherever we operate.
So very meaningful initiatives driving a lot of positive impact. I'd like to talk to you about your voice as a leading voice in the sustainability space in 2022. We know you participated in Expo 2020 Dubai, COP27 in Sharm el-Sheikh. Will you be participating in COP28 in the UAE this year? And what exactly is on your green agenda?
Absolutely. I think this is an area that very much, in our hearts is a priority also. This is what we are feeling also. Yes, I think everybody knows now that, the climate change is a public health crisis. And we need to really act on solid actions and without waiting. So AstraZeneca, this is a priority, a global objective for us. We have a very ambitious target. By 2045, our aim is to be the zero carbon because we feel responsible. As of today, 4 to 5% of the greenhouse gas emissions is due to the actually healthcare industry. So we feel the responsibility here to take some solid actions to solve this problem, this issue, this crisis. And it is not limited just talking in the platforms or sharing and raising the awareness, but some solid actions needs to be done also. And our objective is also to spend up to $1 billion to solve this problem by 2045. Last year in November, COP27 was a great platform. First time AstraZeneca, we formally led an event. It was related with the health and the climate, the link, and it was quite successful. And also there was a green hospital. This was an initiative in Egypt. We did a big hospital, solar and state-of-art hospital. And actually this was used for the attendees of the COP27. And now it is repurposed to be used for other needs of the patients in the country. We love that concept, this mobile and solar clinics. And another example for Africa, in Kenya, again in partnership, one of the strong NGOs, the AMREF, we have 10 mobile clinics actually giving the service to the patients in hard-to-reach areas of Kenya. So this will continue certainly. And this year we are so excited. We'll be meeting here in UAE and the COP28. I'm sure it will be another great platform to bringing together all the relevant parties as a call to action platform as well.
I'm sure you will make the most of it. Thank you so much for joining us today. Pleasure to chat with you.
Thank you. Thank you so much. I truly believe that coming together, working together in partnership, we can tackle everything, all the issues in the planet, in the societies, and with our people.